Good day and welcome. In this training video, we will demonstrate the steps that are taken during the activation, response, and transportation of persons with suspected or confirmed infectious diseases. Ebola, MERS-CoV, and severe respiratory infection, or SRI, are examples of infectious diseases. Although rare, early recognition and appropriate transportation of patients with this condition is critical for infection control. As ambulance personnel, you need to be properly protected when handling these patients. This video will also demonstrate how to correctly put on personal protective equipment, and more importantly, how to correctly and safely take off PPE under the instruction and supervision of a trained observer. We will be presenting two scenarios in this video. The first scenario demonstrates the sequence of steps that will take place when no pre-arrival notification is given and when no contact with the patient is made before PPE is put on. The second scenario demonstrates the response and transportation of persons with suspected or confirmed infectious diseases when the NCC provides pre-arrival notification to responding crew. Let's begin. After you and your partner have introduced yourselves to the patient and family, establish the patient's level of consciousness, patient's respiratory rate, heart rate, blood pressure, temperature, SpO2, and RBS in preparation for your update to NCC. This is in line with CPG-1 primary clinical approach to medical patients. While one crew performs this, the other should obtain a history from the patient using the sample approach. This includes finding out signs and symptoms, allergies, medications, past medical history, last meal, and events leading to the cause. If fever is mentioned or picked up during your assessment, immediately ask about travel history. If the patient or a close family member that lives with the patient has traveled outside Qatar within the last month, contact the CTL on Clinical 1 and inform them of your findings. The CTL will inform you whether you will continue treating the patient using standard precautions or you will isolate the patient in a room and inform them that in line with our protocol, a second ambulance will be sent to transport them to hospital.
Okay, just now you are okay. Don't worry. According to our protocol, you have to bring another ambulance, but just stay here. Don't go to any place. Just to wait for the other ambulance. Okay? Don't worry. Yeah?
For purposes of this video demonstration, we wanted to show the process of donning PPE more clearly in the studio. However, donning PPE should ideally take place inside the ambulance. First, remove all personal items. This includes items such as jewelry, phones, wallets, and pens. Next, inspect our personal protective equipment to make sure we have everything laid out in proper order. This is the A18 pre-pack kit. This includes regular gloves, sizes are medium and large, nitrile purple gloves, large and extra large, Tyvek suit, medium and extra large. N95 mask, small and regular. Face shield, boot covers, and surgical mask for patients. At this point, we would like to emphasize that the following procedures will only be done under the supervision of a trained observer. Clean your hands with antiseptic hand rub. Make sure you practice proper hand hygiene. Put on the first pair of gloves after making sure your hands are dry. This is also called the inner gloves or regular gloves. Next, sit on a clean chair and put on the Tyvek suit. At this point, do not put the hood on yet. Make sure that the inner gloves are tucked under the sleeves of the gown as shown. Put on the boot covers. Pull them up to the mid-calf and secure. Secure properly. Clean hands again with antiseptic hand rub. After that. Next, put on the N95 mask. Remember to hold onto the double straps as you do this. Put the top strap first over the head and keep it above the ears. Bottom strap goes under the neck. Ensure the seal. Now, put on the hood and pull it down to cover your hair, ears, and neck. Put on the face shield as shown. This is to protect the front and sides of the face, including the skin and the eyes. Disinfect your gloved hands. Put on the second pair of gloves, which is the purple nitrile pair. Make sure the cuffs are pulled over the sleeves of the gown. At this point, your trained observer will verify the PPE.
Now let's verify if you're comfortable.
Turn around so they can inspect you.
Hand sideward. Okay, down.
Also go through a range of motion to make sure you can move freely and comfortably.
Okay, up to the left. Okay, hands up again. It's okay.
Before you go to the patient, we need to disinfect your hands. Apply disinfectant to your gloved hands now. Before going to the patient, do not forget the surgical mask. During this time, the trained observer can start loading the stretcher inside the ambulance. Bear in mind that you are not to provide any treatment at this point. Introduce yourself to the family and give clear instructions on how to wear the mask. The patient will be given a surgical mask to wear before loading. If he is able to walk, he will be escorted to ambulance. If not, he should be transferred to ambulance by stretcher.
Hello. Yes, morning. This is Romeo with you. Okay, copy that. So confirm we are receiving a patient with suspected infectious disease. Okay. I will update the head nurse and prepare the contamination room. Copy that. Thank you.
The Romeo officer now goes to the decontamination room to do a routine check. He is making sure the following are present: trash bin with red bag, hand wipes, paper towels, gloves, automatic hand sanitizer, 2 dirty chairs, and 2 clean chairs. Upon arrival at the A&E, proceed directly to the entrance of the female emergency department. Please stay in the ambulance until the trained observer arrives. The trained observer will guide you when it is safe to unload the patient. Once the patient is handed over, the crew should immediately return the stretcher to the ambulance and make their way to the decontamination unit. After patient handover, be aware that your PPE is contaminated. Do not touch anything or come into contact with any object. The trained observer needs to be there to supervise the removal of the PPE and its proper waste disposal. The role of the trained observer is to make sure the removal of PPE occurs safely and carefully. He will make sure that he is at least 2 meters away from you and is keeping a safe distance at all times. Do not remove the PPE without the supervision of a trained observer. Notice that we perform hand hygiene after each step of removing PPE. First, turn around and inspect if there is visible contamination, cuts, or tears. Now sit down and carefully remove the boot covers. Use a chair specified for removing boots and shoe covers. Next, disinfect and remove outer gloves. Do not contaminate inner gloves. Now, we're going to inspect the inner gloves and make sure there is no contamination, cuts, or tears. We will also perform hand hygiene. Remove the face shield by tilting your head forward, grabbing the rear strap, and pulling it over your head without touching the front of the face shield.
Then disinfect the inner gloves.
Again, we're going to perform hand hygiene. Carefully remove the hood cover as shown, touching only the inside of the suit with your fingers. Pull the Tyvek suit away from the body. Roll the suit inside out. Again, touch only the inside of the suit with your hands. Again, disinfect gloved hands, and then remove inner gloves by rolling them off your hands. Disinfect your bare hands and then put on a clean pair of gloves.
This new pair of gloves is helpful to add another layer of protection, bringing your hands close to your face to remove the N95 respirator. Again, we're going to perform hand hygiene. Now sit on a clean chair and use a disinfectant wipe to clean your shoes. Remove the inner gloves, making sure you only grab the outside of the glove. Slowly pull it off. While holding the first glove with the gloved hand, slide your finger underneath the second glove and slowly pull it off without touching the outside of the glove.
This concludes our training video in the activation and response of ambulance service regarding patients suspected of infectious disease. We have also demonstrated the proper techniques for putting on the PPE and the safe removal of the contaminated PPE. The role of the trained observer is critical to ensure that the crew is properly protected in the use of PPE. Here are some key points you should remember. If the infectious disease tool is activated, do not approach the patient. Wait for the trained observer who will supervise the proper donning of the PPE. For persons under investigation, it is important that he is brought to MCT isolation unit at Hamad General Hospital. There is no effective treatment that can be done for him on scene. Make sure that the surgical mask is already fitted on him at the scene and during transport. After patient handover, proceed to the decontamination room immediately. Your suit is contaminated after patient contact. Take extra care when you are removing the suit and remember that the trained observer should be there to supervise. Lastly, remember to observe proper hand hygiene always. Thank you. Continue to give effective care. It matters.